This is One on One.
Welcome back to One on One. I'm Joanna Gagos, sitting in for Steve Adubato right now. I'm joined by two folks from Caldwell University. First, Dr. Kathleen Kelly, who's the Associate Professor and Assistant Director at the School of Nursing and Public Health at Caldwell University, and Natalie Pedri, who is a senior in the nursing department, also at Caldwell. Welcome, both of you.
Thank you for having us.
Thank you for having us.
Beyond the terrific work that you're both doing in the nursing program, there's a really, really powerful personal story here. Natalie, I'm going to start with you. You were in your junior year at Caldwell, applying some of the techniques that you had learned from Dr. Kelly and in the program, and had a really powerful personal discovery. Tell us about it.
Yeah, so I had Dr. Kelly my junior year in the fall. She was my professor for health assessment, and in that class we learned all about how to assess ourselves.
What does that mean, assess yourself?
Well, when you're a nurse and you have a patient, you have to assess them, like listening to their hearts, checking their lungs, and also feeling around their bodies to make sure that they don't have anything abnormal going on. So I was completing a self-assessment my summer before entering my senior year, and I found something in my abdomen, and it felt very large, and I didn't think that it felt right. So I had actually had an email from Dr. Kelly sitting in my inbox that was like, "Hey, Natalie, you missed your assignment." But I was thinking about, I just missed it because I had so much going on, and like, I was thinking about like what this could be.
So this was consuming your mind. You felt
Yes.
something, you were concerned by it. It started consuming you. Did you think it could be something, but what did you think it was?
I had no idea. I was Googling stuff as
Usually
anybody
not
would
a
do.
good idea,
No, it's
right?
not a good idea. So
you find the worst prognosis.
By that time, I had like 10 different cancers and a bunch of other diseases.
So what did you do? What did you discover?
I actually answered Dr. Kelly. I was like, "Hey, can you give me a call?" And she's like, "Are you okay?" I was like, "No." So I explained to her what was going on, and then she told me I should go see my doctor. And after a bunch of scans and testing, I got diagnosed with stage 4 Wilms tumor, which is a pediatric cancer.
That is probably not a very commonly understood or known cancer. Explain just a little bit what it is, what the treatment was like for you.
So it's a rare kidney cancer. It usually happens in children under 5 years old. So when I got diagnosed, it was a big shock to my team and as well as everybody else. So I had to go through surgery to remove my kidney and the tumor, which was almost, it was over a foot long. So it was deep in my abdomen, and they removed the kidney, and then they found that it was in my lung as well. So after they did that, they started chemo and radiation. So I went through 6 months of chemo, and I went through 14 days of radiation.
And how are you doing today, Natalie?
I'm doing well. I finished my treatment in March, and now I'm just starting my life after cancer back in the nursing program.
So you're back at the nursing program, back with Dr. Kelly. Dr. Kelly, as you're listening to this, you are teaching the most basic and important elements of healthcare, one of those being assessment, not just of the patient, but of yourself. You yourself have a personal story to share with cancer. Tell us quickly.
So I went for my regular mammogram, and they saw a spot on my mammogram, and I went for further testing, and I had breast cancer. And when I went to had the first biopsy done, it came back a particularly high grade, which is not a good diagnosis. So although the stage was early, the grade was not good. And I immediately went in for a radical mastectomy with chemotherapy and radiation to have done. And it was tagged back because of the makeup of the tumor to the work that I did at the World Trade Center.
Wow.
I was a healthcare provider at the World Trade Center site.
That has to carry with it a ton of emotion, right? But you're teaching at the time that you get this diagnosis. Were you open with your students at the time about what you were going through?
From the very beginning.
Why?
I was. Because we're nurses, and nurses share and nurses learn. And the way that nurses learn is by understanding what's going on with their patients and understanding what's going on in the community. And I needed to educate my students that breast cancer could happen to anyone. And I wanted them to share in the journey with me and learn firsthand what it was going to be like, and for them to understand how this was going to affect me. And they were absolutely amazing when it came to me. with their support. They all wore pink ribbons. They were wearing pink shirts all the time. They were just absolutely amazing and supportive.
There's a secondary level of something that's going on here that I'm seeing. There's the clinical side, right? And what you're teaching in the classroom, the self-assessment, the importance of understanding how to do an exam, not just on someone else, but on yourself. And then below that, below the surface, what there is this human connection. And it's you with your students, and your students being able to trust you and understand that you're open and honest with them. And I see that you reached out to Natalie to say, is everything okay? Something, you had a sense that something wasn't right. Why is that human connection so important, not just as a healthcare professional, but as an educator?
Well, at Caldwell, we have a very, very tight-knit relationship with our students. That's one of our best attributes at the university. And it wasn't like Natalie to miss something. And I had a nagging suspicion that something wasn't right with her. And when she called me, she had the trust to call me and tell me what was going on. I said, Natalie, you need to go see someone. And then I immediately started looking up, what could this be? And that it had to be a Wilms tumor. And then she called me and said they were sending her to Sloan and that they thought it was a Wilms tumor. And so I started to support her going through, because I could answer her questions honestly. What was chemo like? What was radiation like? And
coaching her through that process.
Coaching her through. I sent her the shirt I wore through my chemotherapy for her to wear, and then she did the same for me.
It's like the sisterhood of the traveling shirt, right?
That's exactly what it is, yes.
And last question for you, Natalie. How has this experience impacted your goals as a healthcare professional?
Well, now it definitely is a change in career for me, because I definitely want to go into pediatric oncology now. I think that as a nurse, I could help my patients the same way that my nurses helped me, like Dr. Kelly helped me when I was going through it. So I think that I could be a good asset to a pediatric oncology team now that I've had that experience, not only as a nurse, but, as a patient, because it's a whole different side from, it's hard being a patient. It's not easy, and I never realized it. But now definitely I have more compassion and more empathy, for my patients.
I can't thank you both enough for coming here, sharing your personal stories, and for all the work that you're doing to help others. So thank you so much. And don't go anywhere, because we are coming back with more One-on-One right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Delta Dental of New Jersey, the Healthcare Foundation of New Jersey, Kessler Foundation, the New Jersey Reentry Corporation, New Jersey State Nurses Association, and the Institute for Nursing, New Jersey Sharing Network, and by Community Food Bank of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with TriStar Studios.